Okay, so how do you choose a plastic surgeon, and particularly one that's going to do a breast augmentation, or really any procedure? So there are a number of really critical factors to look at when you're choosing your plastic surgeon. I think most people inherently kind of go through these steps, but there are a couple that are really critical, and it's what I use to choose a surgeon to operate on me or my family. So those really include board certification. So it's really important for any plastic surgeon or any physician in their area of specialty to be board certified in their specific area. Unfortunately, there are a lot of physicians, there are a lot of even non-surgeons doing cosmetic surgery. So it's really important for you to kind of research background, and board certification is a really critical aspect of that. The second, I think, is word of mouth. I think that to really ask around and determine who in town or in your region or in the area, or best you can determine on the internet, even out of state, does a really comprehensive, great approach for the procedure that you're looking for. So at the Bengtson Center, it's really interesting. We look at all of our patients, and at least 30% are beyond 200 miles of Grand Rapids. I've operated on patients from every state, every area of Canada, every region of Canada. It's a province, I think it's called. And then also Western Europe. So we see patients from everywhere, and we get a lot of inquiries, from the website and from word of mouth. One of our nurses was actually just in Denver, Colorado, and having dinner, sitting up at a bar before she's going to sit down and eat. And this lady just strikes up a conversation and is like, what do you do? She's like, I'm a nurse, I'm a surgical nurse. And she said, oh, really? Where do you work? And she said, in Grand Rapids, Michigan. She goes, I work for a plastic surgeon in Grand Rapids. She goes, who is it? And she said, Dr. Bengtson. She goes, oh my gosh, he just did my breast augmentation revision like 2 weeks ago. So crazy. I mean, so we, our scope is really broad. I think it's really important that you research and look also at the experience of surgeons. So, it's, I specialize, really hesitate to use that word, but I specialize. I really do certain things. I do the full gamut of cosmetic or aesthetic surgery, but there are a lot of things in plastic surgery that I don't do. And even if I go on mission trips and those sorts of things, if I'm not proficient, if I don't do those procedures a lot, like cleft lip and palate, burn surgery, I don't do those surgeries. I don't offer those surgeries even to patients in third world countries. There are surgeons that do that very well, and I'm certainly there to support and do things that I do really well. So I think it's really important to do your research, particularly what the experience specifically is of the surgeon. And then we talked a little bit earlier about, here are all the critical, important things. This is where the state of the art of breast augmentation is today. It's using the best implants available with the highest cohesivity that are the safest type of implant available. It's using simulation, it's using surgical techniques that are very precise, bloodless, follow up with ultrasound. All these things, super important, because this is not just a transaction. This is actually a lifetime, potentially a lifetime outcome. So you really want to really look at it as an investment in yourself and really do your research.